A comprehensive overview of norovirus. Norovirus is a highly contagious virus that causes gastroenteritis, commonly referred to as stomach flu. Characteristics are belong to the Calciviridae family of viruses, can infect people of all ages, known for its ability to spread rapidly in crowded places like schools, hospitals, and cruise ships. Nickname is winter vomiting bug due to its frequent occurrence in colder months. Notable traits: resistant to many disinfectants, survives on surfaces for long periods. Key facts about norovirus. Highly contagious, norovirus spreads easily through contact with infected people, surfaces, or contaminated food and water. Common causes of gastroenteritis. It is one of the leading causes of gastroenteritis stomach infections worldwide. Symptoms include vomiting, diarrhea, stomach cramps, and sometimes fever. Rapid onset: symptoms usually appear 12 to 48 hours after exposure. Short duration: most people recover within 1 to 3 days without long term effects. Survival on surfaces: the virus can survive on surfaces for days or even weeks, making it easy to spread. No vaccine. There is currently no vaccine to prevent norovirus infection. So the next is causes and transmission. How does norovirus spread? Person to person contact. The virus spreads when an infected person vomits or has diarrhea and the virus gets on surfaces or hands. Contaminated food or water. Eating food or drinking water that has been contaminated by the virus can lead to infection. Touching surfaces. The virus can live on surfaces for a long time. Touching these surfaces and then touching your mouth, eyes, or nose can spread the virus. Airborne particles. When an infected person vomits, tiny particles in the air can also spread the virus. Close quarters. Norovirus spreads quickly in crowded places like schools, hospitals, and cruise ships. So the next is symptoms of norovirus infection. Recognizing the signs: vomiting, sudden and frequent vomiting is a common symptom. Diarrhea, watery and frequent diarrhea often follows vomiting. Stomach cramps, pain and discomfort in the stomach. Fever, mild fever or chills can occur. Headache, many people experience headaches along with other symptoms. Fatigue, feeling tired and weak is common, sometimes making it hard to get out of bed. Let's talk about who is at risk. Vulnerable groups. Young children, they are more commonly likely to get severely dehydrated due to vomiting and diarrhea. Older adults, elderly people have weaker immune systems, making them more vulnerable to severe illness. Pregnant women, they may experience more severe symptoms and complications during infection. People with weakened immune systems, those with conditions like cancer, HIV, or organ transplant, at a high risk for serious illness. Healthcare workers, due to their exposure to sick patients, they can catch and spread norovirus easily. So here are norovirus outbreaks real life examples. Cruise ship outbreaks. Example: in 2012, a major norovirus outbreak affected over 700 passengers and crew on a cruise ship. The virus spread quickly in the crowded confined space, leading to widespread illness. Schools and daycares. In 2019, a daycare center in the US had a norovirus outbreak affecting dozens of children and staff. The virus spread quickly due to close contact and shared toys. Healthcare facilities. A hospital in the UK experienced a norovirus outbreak in 2018, leading to a closure of several wards to control the spread. Vulnerable patients like the elderly and those with weakened immune system were most affected. Restaurants and foodborne outbreaks. In 2015, norovirus was linked to a foodborne outbreak at a restaurant in the USA, sickening dozens of customers. The virus spread through contaminated food prepared by an infected worker. Next is identifying norovirus clinical diagnosis. Doctors often diagnose norovirus based on symptoms like vomiting, diarrhea, and stomach cramps, especially if there is an outbreak in the community. Laboratory test. PCR test polymerase chain reaction, the most common and accurate test to detect norovirus in stool samples. Enzyme immune assay EIA, another method used to identify the virus in stool samples, though it's less sensitive than PCR. Rapid test. Some rapid tests are available, but they are less commonly used due to lower accuracy. No routine test. Routine testing for norovirus is usually not done unless there is an outbreak or specific symptoms, as the virus typically resolves on its own without needing a diagnosis. Prevention tips. Staying safe from norovirus. Wash hands thoroughly. Wash hands with soap and water for at least 20 seconds, especially after using the bathroom and before eating. Disinfect surfaces regularly. Clean and disinfect frequently touched surfaces like doorknobs and countertops using a bleach-based cleaner, as norovirus is resistant to many other disinfectants. Avoid contaminated food and water. Avoid eating raw shellfish and be cautious with food prepared by others, especially if you know that the signs of illness. Stay home when sick. If you have norovirus symptoms, stay home to prevent spreading the virus to others. Avoid close contact with sick individuals. Keep your distance from people who are sick with vomiting or diarrhea and avoid shared spaces when possible. Treatment options: managing the illness, hydration. The most important treatment is staying hydrated, drinking plenty of fluids, or replace lost fluids due to vomiting and diarrhea. Rest. Resting allows the body to recover from the virus. Over the counter medications. Medication like anti-nausea or anti-diarrhea drugs can help managing symptoms, but they should only be used with a doctor's advice. Hospitalization in severe cases. In cases of severe dehydration or other complications, hospitalization may be necessary for intravenous fluids and supportive care.